It's been around since 1960, and it is probably the only diet that I can think of that has not changed, that has not been bashed, that hasn't been trendy, that's had anything negative said about it. And I've seen hundreds of diets come and go. But this one just stays, and it's getting a resurgence now because people are just realizing this really is a great way to eat.
Welcome to the Real GI Doc Show. I'm your host, Dr. Fred Gandolfo, and I'm a board-certified gastroenterologist in New York. And today I have a special guest on the show to talk about diverticular disease and inflammation when it comes to what you should eat and maybe what you shouldn't eat. So we're going to start off today with a case first. And this is a real patient case, so I should say that I've changed some of the information to keep the patient's confidentiality confidential. But we're going to start off with a case of a 59-year-old woman who came in to see me for a colonoscopy and just for routine colon cancer prevention. And we did that a few months ago, and she did very well and no real major issues. We just found some diverticular disease in the sigmoid colon, which was mild, something that was not bothering her. But then 3 months later or so, she called with pretty acute onset lower abdominal pain, as well as some fever and some chills. And she came in to see me that same day, and her abdomen was quite tender. She was visibly uncomfortable, and this was all new for her. She's never had pain like this in the past. So I sent her for a CAT scan, which was done the same day, and I was called by the radiologist with the finding of acute sigmoid diverticulitis, as well as what's called an abscess, which is a pocket or a collection of pus or infection that's adjacent to the inflamed colon from the diverticulitis. And there was no perforation of the bowel, and she was sent over to the hospital where she was given intravenous antibiotics, and she was kept for a day or two for observation and treatment, and she improved, and she was sent home on oral antibiotics, and she finished that course over the course of a week or two, and she felt quite well after that, basically back to normal. But then about 2 months after that, she called again with acute abdominal pain. Not as bad as the first episode. She came to see me in the office. She was quite tender, nowhere near as bad as it was the first time. We made a clinical diagnosis of likely recurrent acute diverticulitis, and she was given oral antibiotics to go home with. And she did well again. But then about a month or two later, she came back to the office with the same issue: lower abdominal pain, mild subjective low-grade fevers, and she was presumed to have diverticulitis again, and she was sent for a CAT scan at this point because it was kind of unclear. And she was also given empiric antibiotics, meaning like she was treated with antibiotics before we made any diagnosis. So she received a few days of antibiotics for presumed diverticulitis, and she had a CAT scan a few days later. That CAT scan actually looked okay, but the symptoms of maybe mild diverticulitis were all there, or maybe this was just a flare-up of some unrelated issue. So diverticulitis is a really common medical condition. It's probably one of the more common things that we see in practice. And what it is, in simple terms, is people develop these little pockets in the colon that are called diverticula, and these little pockets in the colon can get inflamed or infected, and that can cause abdominal pain, and that condition is called diverticulitis. Diverticulitis is a very common condition, and the risk of someone having the little pockets in the colon that will predispose them to get the inflammation part of it, which is diverticulitis, the risk of a random person having that when they hit the age of about 60 is more than half. So more than half the people walking around over the age of 60 have these little pockets in the colon, and that condition is called diverticulosis. Now, about 10 to 20, or maybe even more than that, % of people will eventually go on to get diverticulitis, which is the infection or inflammation part of that disease. And that's what actually causes the pain. So lots of people are walking around with the pockets. You wouldn't even know about it. But one day when they get infected or inflamed, you know about it because you get fever, chills, abdominal pain. It's a pretty symptomatic condition. And that's often when you present for medical attention, then we find that you have these little pockets in the colon. We see these routinely on colonoscopy in people with absolutely no symptoms. It goes up with age, so age is definitely a risk factor for developing it. And when you hit the age of 80, the majority of people have some degree of diverticular disease. But most of those people don't get diverticulitis, which is the infection, inflammation, pain, fever problem. How does it happen? So what's like the what's the risk factors for developing diverticular disease? One of the biggest risk factors is just living in a Western society, because it seems to be in parallel with the Western diet and Western lifestyle. You don't see a lot of diverticular disease in countries that are not modernized, Westernized societies. And there's also a genetic component to this. So if your family had diverticular disease, your mom or dad had diverticulosis, you're more prone to getting it. So some people have no real clear risk factors for it, and they still get diverticular disease and diverticulitis more than you'd expect just from their risk factors. But like I said before, it goes up with age. It's more common in men than in women, although as people age, women do eclipse men in diverticular disease. So as people get older, more women than men tend to suffer from this disease. So it's one of the, in clinical practice, you see it in men and women pretty much evenly. Our case today was a woman, but it could have easily been a man of the same age. The other risk factors for developing diverticular disease, besides age and sex and where you grow up, is obesity. So obesity is strongly correlated to having diverticular disease, especially diverticulitis. It's thought of as an inflammatory risk factor, and you see that in clinical practice also. And then we're going to spend the rest of today's talk mainly focusing on diet and lifestyle for prevention of diverticular disease. But before we do that, and before I introduce our special guest, I do want to talk about the treatment. So patients come in with diverticular disease, basically diverticulitis, causing pain, inflammation, infection, and what do we do about it? So mainstay of treatment really is, or classically is, putting someone on bowel rest. So you give someone either nothing to eat, or you give them a liquid diet, like a clear liquid diet. And the theory there is that you don't want to make the inflamed colon kind of do anything. You want to kind of rest, quote, rest the colon. And that does help. So there's been studies where you can just do that alone, and a lot of people will get better even without antibiotic treatment, which is the other mainstay of treatment. So really it's bowel rest, antibiotics, and then pain control. Those are like the three things that you do to treat uncomplicated diverticulitis, meaning there's no perforation in the colon, there's no abscess, the patient's not like septic and sick, and they're basically okay besides the inflammation in the colon. So it's bowel rest, pain control, and antibiotics. And typically oral antibiotics are fine. You can give antibiotic pills as long as the person can take pills by mouth. If they're very sick, vomiting, having severe abdominal pain, or have complicated diverticulitis, meaning they have an abscess in the colon, they have a perforation in the colon, or they have some type of bowel blockage or something related to that, then you go with the intravenous antibiotics. And that's basically a clinical decision really based on the imaging and based on the labs and based on the patient's other risk factors for doing well or doing poorly. But for this 59-year-old woman who's otherwise very healthy, if she didn't have the abscess in her colon on the initial CAT scan, then we could have gotten away with just sending her home on bowel rest, just clear liquid diet, or nothing to eat for a day or so, and then the oral antibiotics. But since she had the abscess, she was quite sick, she had a fever, she really was in severe abdominal pain. That was someone that we sent to the hospital to treat there, because sometimes surgery is one of the things that you do to treat diverticular disease like this. So if all else fails, you can take out the disease part of the colon, but we try really hard not to do that, especially in the beginning. We really try to treat with antibiotics, cool the inflammation down, and go from there. So at this point, I'd like to introduce my guest. Today we have registered dietitian Stephanie Schiff. And Stephanie is a registered dietitian and nutritionist and a certified diabetes care and education specialist. And she's worked at Northwell Hospital for the last 11 years. Stephanie has appeared on News 12 Long Island and Fox News speaking about nutrition and lifestyle. She's also been heard regularly on WCBS 880, and she writes for Northwell The Well, and she's been quoted in many online articles such as U.S. News and World Report and CNN.com. Hello, Stephanie.
Hi, Dr. Gandolfo. How are you?
Good. Thank you for coming on the show today. I'm very excited to hear all about what we do with these patients.
Thank you for having me.
My pleasure. In terms of our patient today, Mrs. 59-year-old woman with diverticulitis that keeps happening to her. So she's had at least 2 documented episodes, 3 symptomatic kind of attacks, and it's all happened within a few months. So something's going on there. And when patients come to me with these kind of issues, they often really want to know, like, what do I do dietary-wise? Like, what do I do nutrition-wise? What am I doing that's causing this? The antibiotics treat me, I feel better for a couple of weeks, and then it kind of comes back. So, like, what can I do to prevent this from happening in terms of my diet, my lifestyle?
Well, diet is huge in terms of diverticulosis, diverticulitis. It's huge for any kind of GI issue. So you mentioned before that when a patient has a diverticulitis flare-up, and we have several of those coming into the hospital, you treat them with clear liquid diet or no diet at all, give them bowel rest, and that's very common for us. And they do want to know what to eat when they go home. One thing people seem to be a little bit confused about is, and I understand why, because this was a habit for years, we would have patients coming in and their doctors would tell them if they had diverticulosis to avoid seeds and nuts and popcorn and the skins of fruits and vegetables. So they would come in, they would say, I don't even eat any of that. And I now have to tell them, well, actually you should. So if you don't have a flare-up, if you just have diverticulosis, but you're not feeling any symptoms, you're fine eating a high-fiber diet. And actually, studies show that you'd be better off if you eat a high-fiber diet rather than staying away from these food items. And studies have been shown, they have given people with diverticulosis a diet high in seeds, nuts, and popcorn for several weeks, and they actually, nothing happens to them. So the first thing to do is when you're not having a flare-up, you do want to eat a high-fiber diet. If you are having a flare-up, again, that's a whole different story. Then you're going to go with the bowel rest, the clear liquids. But if you're feeling fine, if there are no symptoms, my suggestion is to go into a healthy plant-focused diet, such as the Mediterranean diet, and that seems to be the first place to start.
Got it. That's right. It's important to have the distinction between active acute diverticulitis, which is like an inflammatory condition, pain, fever, that's when things are going wrong, versus like the diet to prevent getting that from happening. So diet to kind of not get diverticulitis. So lots of people are walking around with the pockets, but they're not causing any problems because there's no inflammation. So the diet to maintain yourself or to potentially reduce the risk of getting diverticulitis, which is the bad thing that happens with diverticular disease, one of them at least, seems to be like a more high fiber diet.
Right.
And in terms of the seeds and nuts, can you give me more info on that? Because we were always taught the same thing, that you try to avoid seeds and nuts. Everyone still comes in saying, I can't eat whatever bagels with seeds on it and pasta sauce with tomato seeds in it because I'm going to get a flare up of my diverticulitis. And I know that that's like old school thinking, and I don't know where it came from. I guess that just theoretically people worry that the seeds are going to get stuck in a pocket and scratch. Patients come in saying, I don't want that popcorn to scratch the pockets inside of me, but that's not really what happens. And I don't think has there ever really been evidence that causes like diverticulitis to happen? Based
on the research I've seen, no. They've done extensive research. They found nothing in the pockets, and they've also found no perforations caused by the popcorn or the seeds. So there is no evidence, but I think people are really stuck on this. And I would say for the people who do come in and they say, no, I have diverticulosis and I have to have a plain bagel instead of one with seeds, which stay away from the bagels anyway. Then if it really affects them and they find that after they eat something that's a little rough, then stay away from it if you think it affects you. But I would not tell that to the general population.
Yeah, I agree. I mean, that's what I say too, is that I've never seen a surgical pathology report, like if they take out a part of someone's colon for diverticular disease, that says like, we found, 3 poppy seeds and an onion bagel in there or something like that. Like you don't see that stuff in the pathology reports. And they literally look at it like under the microscope. So I don't, maybe like once in a while it could possibly happen, but I don't see that as a major thing. But then people anecdotally will say this, they say that I eat this and it flares up, and if you can't argue with that,
all the time, yeah.
That's it, right? That's an N of one. It's a study of one person, and you can't argue with that person because it probably does happen in that person. But in terms of the whole world at large, you probably don't have to strain your pasta sauce and watch out for the tomato seeds.
No, and it's too bad because these people are walking around saying, oh, if you've got diverticulosis, don't do this, don't eat this because I get a flare up. And I think people, this podcast is great because if anybody out there realizes, I'm so afraid to eat these seeds and nuts, but actually they can help me. If I eat more fiber, maybe I'll feel better and get healthier. That's awesome.
Yeah. What's the whole thing about seeds and nuts and being actually anti-inflammatory?
Well, seeds and nuts and whole grains and fruits and vegetables, those are all considered to be anti-inflammatory foods. And I think the Mediterranean diet is it's actually sort of the epitome of the anti-inflammatory diet. So you want to reduce inflammation in your body, and in terms of diverticulitis, that's inflammatory, and so are diseases such as heart disease and cancer and diabetes. Pretty much any chronic condition is going to be inflammatory. So you want to reduce the inflammation in your body. So you want to eat anti-inflammatory foods. And that's basically, if you can eat a plant-focused diet or a plant-based diet, and I'm not talking about vegetarian diets or vegan diets, just mainly plants, that seems to lower the amount of inflammation in your body. And then there are things that you would avoid if you want to reduce the inflammation in your body. Now, going back to the Mediterranean diet, this diet has been around since 1960, when a scientist and his wife went to Greece and Italy, and they did a study on the health of the people that lived there, and they found out that there was a very low rate of heart disease, lower cholesterol, lower blood pressure, actually better health across the board. And they started to look at them, and they thought, oh, well, what are they all eating? And this is how the Mediterranean diet sort of came about. And it's basically a plant-based diet, and it's got your nuts, your seeds, your whole grains, your fruits, your vegetables. It doesn't have refined products because they weren't eating they didn't have factories to refine foods. They were eating whole grains. They were eating fish because the fish was out in the Mediterranean. They were eating a little bit of cheese, not a whole lot of dairy, and they were eating very, very little red meat. Just as the years went by, we discovered that the countries that do live, that are around the Mediterranean Sea, had the same commonality, where their people were living a long time and healthier. So we just looked more and more as to how they were eating and how they were living their lives. So the interesting thing is, I've been following diets for, oh my gosh, forever, back to the time I was a little girl and reading Good Housekeeping magazine and whatever. And so I've seen a lot of diets come and go, and even in the last 10 years. And before I go into diets, I want to just mention that when I use the word diet, and I'm sure you also, we're not talking about some way to lose weight. We're talking about a lifestyle. So if we're talking about the Mediterranean diet, it's been around since 1960, and it is probably the only diet that I can think of that has not changed, that has not been bashed, that hasn't been trendy, that's had anything negative said about it. And I've seen hundreds of diets come and go. But this one just stays, and it's getting a resurgence now because people are just realizing this really is a great way to eat.
Right, and it's reasonable too, because you can go out to eat, you can live a life and still eat that way. It's not a super restrictive kind of trendy thing. You don't have to only eat meat, or it's more of I can go out to most restaurants, sometimes places where you think you can only get junk food. Like you can go to a pizzeria technically and get something that's on the Mediterranean diet menu. Maybe not a slice of pizza, but you can order something. Oh,
definitely. You can have a salad. You can have some bread. You can have olives. They cook with olive oil. So there are a lot of components in any restaurant. And that's another thing. I think the Mediterranean diet, if anything, gets a little bit of a backlash these days because people say, oh, well, that's just for people who are Italian or Greek. But you can take the basic components of the Mediterranean diet and make it fit in any country in the world, in anybody's way of eating. You might not, maybe you don't have access to fish, but if you can't fish, you could still get fish at the supermarket. So you can have different grains. Greece will have different grains than Eastern Europe will. It's the basic components that you can actually fit what you like and what is nearby. And the other thing I like about the Mediterranean diet is it is based on the availability of the food around you, on what's local. It's based on the seasonality of what's around you. Right now, I'm eating a tomato a day because they're around, they're inexpensive. So if you eat seasonally, that can be very budget friendly. It's not restrictive. There's so much on there, and you could really just mold it to what you want to do. And the best way of eating, the best type of diet, is one that's sustainable. If it's going to torture you for a month or two, you're not going to stick with it. But if you find that you like it right off the bat, it becomes a part of your life, and it's no longer a diet. It's just the way you eat.
I agree. You have to be able to do it forever. So just like exercise is like that too, right? So people want to get in shape and they do some crazy exercise plan that works great for a couple months, and then it just kind of falls off because you can't keep that level of intensity. It's too much work. It's much better for the long term to do a little bit of something that you like to do or can do every day than to just go all out for a few months and then kind of just fall back to whatever you were doing before. We measure these outcomes in terms of years or like a person's lifetime. We don't measure it month to month based on what you're eating that month. It seems like it's a very short-sighted goal. one of the things that comes up, I'm a big fan of the Mediterranean diet too, and one of the things that comes up when I try to explain it to patients is they always ask me about wine and alcohol, because they think of these diets and like, oh yeah, you got to drink extra red wine because it's like, it thins your blood and it's anti-inflammatory. And one of the things I try to talk about is which I didn't mention earlier, is that some of the risk factors for diverticular disease and gut inflammation in general, alcohol's a big one. Smoking's a big one. I didn't mention that, but everyone knows that's bad for you, so we'll leave that out. But alcohol is actually a big pro-inflammatory mediator or substance for your entire GI tract. I don't know how you feel about that with the Mediterranean diet.
I get that a lot. People love to come in and say, well, the Mediterranean diet, I see wine on there. That means I should be drinking it. No, not really. And actually, the American Heart Association, and a lot of people quote the American Heart Association to me all the time. Well, the American Heart Association says you can have 1 glass of wine a day if you're a woman and 2 glasses if you're a male. But even they're changing their stance. Everyone is changing their stance on alcohol. It is amazing. And I've seen so many studies that say, if you're looking for the level of alcohol drinking that is healthy, it isn't there. It's just not there. There is none. It used to be like you used to be able to have 1 glass of wine a day, and that's the healthiest. Now it's basically 0. So what I tend to tell my patients is, if you're not drinking, don't start drinking because it's on the Mediterranean diet, or the American Heart Association said you should, or that the French diet of 20 years ago, everybody was drinking wine and eating bread with butter and skinny as anything. So don't start if you haven't already started, and definitely try to cut down. Now, I don't expect people that are drinking already to become teetotalers. That's really doesn't seem that reasonable for a lot of people. But save your wine or your glass. If you're drinking every day, save it for once a week when you're with your family or with your spouse, and have it with a meal. And think of it as this small time of relaxation rather than getting blitzed. Because then you can sort of look at it, well, it's a way of releasing a little bit of stress, okay? And I don't expect anybody to be perfect on any diet, not on the Mediterranean, not with the alcohol, but don't fool yourself. Alcohol is not a healthy thing, and we're finding it is more and more, it's not healthy. So as much as you can cut back, and wine's probably a good drink to have if you were going to be drinking, because some people tend to drink these drinks with like a lot of sugar and chemicals, so wine is a little bit better, but I'm never going to advise people to drink it, no matter what the Mediterranean diet chart says, because that does go back a little bit. It's just not worth it.
Yeah, I agree. And it's hard to separate with these studies that study, it's just in general with diets, nutrition, lifestyle advice. It's very hard because it's very hard to do like an actual trial of this. You can't put someone in a locked ward in somewhere and just feed them a certain diet for 30 years and see what happens. It's not practical to do that. So, we look at outcomes from like populations. We look at entire countries or, regions of people or whatever it is, cohorts of lots of people, and to kind of figure out what their styles of eating, how that affects all these different health outcomes. It's very hard to prove cause and effect. You can infer that from like just the large body of data that shows that people who eat a certain way do have certain diseases more commonly, less commonly. But it's hard to say like in any individual person, if you change the diet, this or this will happen to you. And it's hard to separate some of the cultural stuff with these diets too. Like the way we live here in the US, even if we eat a perfect Mediterranean diet, it might not be the same as if we were living in Italy and eating that same diet. I mean, we tend to work longer hours or crazier life, schedules. We tend to not have as much family time. We tend to maybe not have as much relaxation time. I'm making a case to move to Italy for myself, actually. No, but I think it's one of those things that it's hard to like separate the totality of someone's lifestyle and tease out these little individual health outcomes. And I think one of the other ways you can do it, which makes more sense, is like you can look at the opposite of like what's the opposite of the Mediterranean diet, or like how should you not eat to get if you want to stay away from inflammation in your GI tract. And I picked for this talk, I kind of picked diverticulitis because it's like a very visible sign of inflammation in your gut. Now there's a lot of like these phantom inflammatory diseases that we can't see the inflammation unless you're like doing them under the microscope. You're taking a biopsy, something like that, or it's like you're measuring substances in the blood in experiments that go along with inflammation. Like there's a whole idea of gut inflammation that's like you can't see it, you can't measure it unless you're in a study. It's probably there, But this is the diverticulitis is like a really good prototypical kind of thing to talk about because you can see the inflammation there. You can do a CAT scan. You can take a piece of colon out. You can get a biopsy. You can see it on a colonoscopy. If you're doing a colonoscopy, someone's inflamed. It looks red and angry, and you see pus and everything. It's like clearly inflamed. And what's happening is on a microscopic level, in one way, is that there's gut bacteria, like normal colon bacteria that live inside your gut, that's leaking into the wall of your colon and kind of getting into the bloodstream and causing inflammation in your body. And what was the point of me bringing this up is that let's look at things that cause inflammation and like how should we, if we wanted to get diverticulitis and cause inflammation, like how would we eat? And then is that different from the Mediterranean diet? And then how, like what kind of conclusions can we draw there?
Well, if you want to get the inflammation in your body, you eat the typical American diet, also called the SAD diet, SAD for the standard American diet, the Western diet, whatever you want to call it, which actually, if you do studies in Europe now, it's tending to go a little bit further towards the Western diet as all our fast food places go over there. And they're getting, and you can see how the rates of certain illnesses are going up over in places like Italy and France. The biggest thing, as important as what you do eat in the Mediterranean diet, which again is plant-based, plant-focused, seeds, nuts, grains, vegetables, fruits, even more importantly, and I would even tell somebody to do this right now, is the processed foods that we take in, because they are doing so much damage to our insides, our outsides, and they cause inflammation. And there have been study after study that the more processed foods you eat, the more chemicals you put in your body, that increases the inflammation in your body. It causes dysbiosis, this imbalance in the good bacteria and the bad bacteria in your gut microbiome. It causes a weakness in the intestinal wall, so you get the leaky gut, or I don't know if we like to say leaky gut. Some people hate that.
I have a love-hate relationship with that term because it's a real thing that physiologically happens in certain conditions for sure. And diverticulitis is one of them, and celiac is one of them, and IBD, the inflammatory bowel disease, and Crohn's, and ulcerative colitis. There's lots of things have to do with abnormal barrier function in the gut. I think the problem is it gets used as like a catch-all for everything that's wrong with people. So and people come in asking, they're like, hey, I have leaky gut, as if it's a diagnosis in and of itself, where I feel like it's a byproduct of another disease, or it's a symptom of a dietary pattern or something like that, where that's not like, you don't just have leaky gut like you have heart disease. It's very nebulous, I should say. So when people come in saying they have leaky gut, it's more of like they don't feel well. They feel like, quote, inflamed inside their body, or they feel bloated, or they just kind of feel sick, or they talk about feeling this brain fog thing. But it's not like, I can't just like test them for leaky gut and like give them the cure to leaky gut, because half the time it's not that. It's just or maybe it is. We can't prove it. So that's why I think diverticulitis is a good thing to talk about, because that's clearly like a leaky gut,
right?
Because you can see it like under the microscope, or like in real life,
yeah,
or in a CAT scan. Like what's happening. It's there. That's been studied. Some of this other stuff is very nebulous, but I'm sure like on a microscopic level, how does what we eat like affect us like on a microscopic level in our GI tract? Like there's something happening with that barrier function in your gut. There's mucus layer there, there's epithelial cells, and they're like not doing what they're supposed to do because you're getting inflammation there. And you shouldn't. You should be tolerating the microbes in your gut, not fighting them. And this has been implicated like all kinds of other diseases that we don't understand exactly how they happen. So it's very hard to come out and say like this is leaky gut's a thing and it causes inflammatory bowel disease. It's associated, but it's hard to say the cause and effect, what comes first, what's a symptom of the disease and what's the cause of the disease. But ultimately diet kind of plays into both those things. Yeah,
and definitely a lot of people have, I sort of like the visual of the leaky gut, because what I picture is we have the intestine that has intestinal lining, and you need it to be impermeable. So how do we get it? What happened? What makes it degrade? So we talk about the gut microbiome and keeping the epithelial layer nice and solid, and how are we doing that? And one of the reasons that we love the Mediterranean diet is because, and I haven't used the F word yet, which is amazing because I usually do immediately. It's my favorite word, and that's fiber. So these fruits, these vegetables, these seeds, these nuts, these whole grains provide fiber in our diet. What do we need that fiber for besides making easier transit in our bodies? I mean, it's great for our GI system. you have a gut and it's got good bacteria and bad bacteria. And you want a good balance there. But one of the ways we wreck the balance is by eating processed foods, putting antibiotics into our body. So the first thing we need to do is, if we don't have the good bacteria, we need to put them back in. And part of the Mediterranean diet is yogurt, which is a probiotic. Other probiotic foods are fermentable foods like kimchi and kefir and sauerkraut. Kefir is actually a drinkable yogurt. Miso, tempeh, they're all fermented or they have probiotics in them. So you put the good bacteria in, but to keep the bacteria happy, you have to feed them like you have to feed any living thing. So now you need the fiber, which the Mediterranean diet also provides. So now that's in your large intestine, and it's not passing through. Most foods go into our small intestine and they're digested and absorbed, and they go into the bloodstream and the minerals are absorbed. But if you have a fiber, it's going a little bit lower down into the large intestine, where it's then fermented by these bacteria. And what's the byproduct of that, or one of the byproducts, is short-chain fatty acids. And they're this magical compound that goes in and sort of strengthens the intestinal layer. So it's making it stronger. They also play a part in creating hormones or neurohormones such as serotonin and dopamine, and oxytocin. So these short-chain fatty acids are key, but one of the things that they do is they protect the inner lining of the intestine. So thus hopefully preventing this leaky gut, whether it exists or not. But in any case, it does happen. You have the fermentation of the bacteria ferment the fiber or the resistant starches, and that shoots out the short-chain fatty acids, and that strengthens the intestine. So that part makes sense. Whether it affects these other diseases, we don't necessarily know. Like you said, it's sort of nebulous, but you can't go wrong with it. I mean, if it's doing all this, then it's got to help something.
Yeah, absolutely. I think obviously what you eat makes a big difference in your overall health, and it's beyond just the nutritional, number of grams of protein and the macronutrients. There's a lot of nuance in terms of what you eat, in terms of really all your diseases. But yeah, the Mediterranean diet is the one that shows up in everything. Anti-inflammatory, it's good for your heart, it potentially reduces cancer risk. I should bring up that, the things that, in terms of like this, the guidelines that we look at as doctors in terms of diverticular disease, the low risk lifestyle they define in these papers, and they find that people who have a low risk lifestyle have a lower risk of developing diverticulitis, and that's kind of defined by, and this is looking at patients who have the disease versus who don't have the disease, fewer than 4 servings of red meat per week, at least 23 grams of fiber per day, 2 hours of vigorous activity per week, so that's exercise, and people who maintain a body mass index in the normal range, so 18.5 to 24.9, so that's people who are normal weight, not overweight, not obese, and no history of smoking. And that's the biggest, those are like the main risk factors they find in people who develop diverticular disease versus who don't. And that, they say people who don't have any of those risk factors, their risk of developing diverticulitis is less than half of the people who do have those risk factors. So it's very powerful. And in terms of these risk factors, and since we're talking about fiber, they recommend 23 grams as the minimum, but what should we really be getting in terms of fiber? If that's the bare minimum, nobody wants to do the bare minimum. They want to do more than that, obviously. This is America. So what do you recommend in terms of fiber intake for like this theoretical 59-year-old woman of normal body weight with no health problems?
Well, the typical American gets about 13 to 15 grams of fiber per day. And I actually think that number is a little bit high. I'd like to circle back at some point to processed foods too, because I don't want to forget about those too much. So we're getting 13, 14, 15 grams of fiber. The American Heart Association recommends 25 to 38 grams of fiber, the higher level for men, and maybe 25, 28 grams of fiber for women. So I could think you can go a little bit higher, but the key thing here is you cannot just go from 13 and 14 to 28 to 38 in a day. Don't do it. Increasing your fiber is a little bit of an art, and you have to do it very, very slowly for a couple of reasons. You can't go to the supermarket. I had picked up, I think it was Total cereal, and I think they had 18 grams of fiber in a bowl. So you can't have this 18 gram of fiber bowl of cereal and then eat the rest of your meals and think you're going to feel fine, because you're probably going to get bloated, you're going to get crampy, you're going to get very gassy, it's going to be very unpleasant. Or even if you just start eating more beans, and back in the day we used to say beans, magical fruit, the more you eat, the more you feel better, which is true. But whether it's the fiber or the beans, people stop because they're like, I don't like this feeling. I get bloated. I get gassy. Don't stop, but do it slowly. Do it gradually. Start with a couple of grams more per day. If you're going to get that total cereal that's got 18 grams of fiber, mix it with your old Cheerios that have like 2 grams of fiber. Sort of slow, do it very, very slowly, gradually, spread it out during the course of the day, and drink a lot of water. Because if you don't drink enough water and you're increasing your fiber, you run the risk of A, getting constipated, or B, possibly getting an intestinal blockage, and you want to avoid both. So I don't want to scare anybody off of that, but just remember, eat the food, the vegetables, and if you want, if you're eating cereal, look for one with a good amount of fiber in it. I like to 5-6 grams of fiber, or 5-6 grams of fiber per serving of bread, but just do it gradually, do it with a lot of water, and you'll have to deal with a little bit of discomfort for the time being, but it's worth it because it's going to do a couple of things. It's going to move things through your system. It's going to decrease the inflammation in your body. It also has the side effect of making you feel full more easily, which may lead to weight loss, which in turn leads to reduction in the inflammation in the body.
Absolutely. Now, you mentioned cereal, but the cereal really if we want to do the Mediterranean diet and be strict at it, do you get to eat cereal? Or are certain cereals better than other cereals?
No, I think I brought up the cereal. I'm not a fan of cereals for the most part, not cold cereals anyway. I brought it up because people will see that there's an easy way to get a lot of fiber in one shot. That's probably the one food that I've seen that I looked at it and thought, oh my gosh, how do they fit all that fiber in there? And it's a very processed food, so that already knocks it off the table. No, I would rather see people get it from whole foods. So your vegetables have fiber, and there are 2 types of fiber. There's soluble and insoluble. Insoluble fiber is the type of fiber that we used to call, our grandmothers and great-grandmothers used to call it roughage. And it's amazing that even back then, they knew what fiber did for us, that it cleared out our insides and that it was very healthy. So that goes in one way, and it comes out basically the same way in our bodies. It's not digested, but the soluble fiber seems to be the one that's most effective in reducing inflammation in the body, because that's the kind of fiber that tends to be fermented by the good bacteria in our bodies. So that's fiber that comes from oatmeal, barley, apples, pears. And what soluble fiber does is it mixes with water and then forms a sort of a gel. And it sweeps the cholesterol out of our body. It can help manage our blood sugar, and it does get fermented by the good bacteria. So it does so much good for basically every system in our body. And if you can't get enough fiber in your diet, I am not opposed to supplements. And my favorite one, which I pretty much take on a regular basis, is psyllium fiber, psyllium husk, and that's the most popular name brand is Metamucil, but you can get it in pills, you can get it in an orange flavored drink. I would much rather, and the American Heart Association recommends, that you get your fiber from foods. It just works better. Anything that you get from food rather than supplements, there's a synergistic effect between all the components in a food item. So you're never going to be guaranteed that a fiber supplement is going to work as well as food will, or that a vitamin supplement or a mineral supplement or an antioxidant will work as well as a supplement as it would in food, because there's too many components in the food that work together, and they're just so good. So I would strongly urge people to get your fiber through food. If you need a little bit of help, I'm not opposed to small doses of something like psyllium fiber.
And I have to be honest here that I have been known to dabble in breakfast cereal that's high in fiber, as a confession. But yeah, I think there's what you should do and then what's practical in the world. And sometimes they look a little different. So I'd much rather, if I'm counseling someone on getting more fiber in the diet in general, the big picture items are just getting enough grams of fiber in a day. And in terms of how they do it, I'd much rather they get fruits, vegetables, whole grains, and don't have to worry about supplements. But then I realize that that's not necessarily practical in everyone's life, so I'll often recommend psyllium. And then other sources of fiber, whole grain bread, not necessarily great to eat a ton of bread. For a lot of people are looking to lose weight, and there's other reasons why they don't want to eat bread, but I'd rather they eat whole grain bread than white bread, for example. And some of this is just like meeting people in the middle where they're at. And if they're 80% Mediterranean diet, I'm much happier than if they're 0% Mediterranean diet. Like there are certain cereals that are, again, they're highly processed foods that are made in a factory somewhere and shipped in on a truck and sitting in a box for potentially 2 years, and they still taste good. That's like the definition of a highly processed food. But I'd rather you eat, highly processed bran flakes that have 10 grams of fiber in a serving with some fruit on top of it, rather than a bowl of Fruit Loops or whatever, Lucky Charms, although those are really good too.
You can mix them with the bran cereal. It's okay.
Lucky Charms bran. It's going to be a new thing. We're going to come out with it. But yeah, I mean, these are all compromises. So I think ideally you don't eat any of that stuff, but in the real world, yes, for sure. If you need a little extra grams of fiber in the diet and you want to have a little bit of bran flake, that's cool. For me, maybe not for you. Don't tell anybody I said that.
No, I agree completely. You have to meet people where they are when it talks about lifestyle changes, because if it's not comfortable for them, they're not going to maintain them. It's not going to be sustainable. And then you're back to square one. I would rather have a couple of steps forward. I don't need to see it all at once. So yes, they could start at brand. And I know people where I've recommended, they're just hardcore cereal people. There are a lot of people out there. I personally don't like cold cereal. So I think, what's the big deal? But they've lived like this, and that's fine. So that's why I'm fine with mixing them with whatever their favorite is. And the multigrain Cheerios are actually really tasty. But I'm totally fine with that. It's like every little step you can take. When it comes to diets, I kind of like to be diet fluid. I don't like labels on some of these diets where you have to do this and you have to do that, because that will turn people off. But every little step you take forward is going to make a big difference. So no, they're fine with that. And maybe later on they'll say, oh, maybe I'll try oatmeal next, or have a egg white frittata for a change. But if they're making that step, I agree. I just don't want them to make too big of a step and do the 18 grams of fiber for 5 days in a row and then say, I'm never doing that again.
Yeah, people come in, it's funny how people use the same terminology, like totally different, having the same experience. And so the common one that people come in and say is, I can't eat salads because they destroy me. Everyone says that. They destroy me. I've heard this 1,000 times. And I think this is people who are not used to eating any type of roughage, and then they go and eat a salad that's like the size of your head with all the stuff inside of it, and all the dressing and stuff too. And then they have diarrhea for like a day, or really like abdominal pain, gas, bloating, all this stuff. You just have to work up to it slowly. And I don't know, is there a magic number of, like, do you tell people, hey, start here with your grams of fiber and then slowly go up every day by a certain number of grams, or every week, or is it you just kind of play it by ear?
I pretty much tell them, add something in that's got like maybe 2 or 3 grams of fiber. Add an extra piece of fruit to your breakfast. Add an extra vegetable to your omelet. Change your bread from this brand maybe to another brand. So I'll pick out one item and say, let's see how we can tweak it and make it a little bit better. And before you know it, you've got all these pieces in place, and it's like, okay, this should be fine for you. And if you want to do more and you feel good, go ahead and do more. You have to do these things gradually. Anything that I see too many people where their eyes glaze over after a while, and they're like, and you realize that if you're not careful, they're not listening to you because they're overwhelmed. And you don't want you want people to think that they can do this, because it's one little change and then another little change. So, or alternate days, have your cereal. And one of the things I love to recommend for fiber, because I love oatmeal. So I tell people all the time how to make overnight oats. You don't even have to cook them. You just mix them in a bowl, and the next morning you pull it out and you eat it. So it's not all that much harder than a bowl of cereal.
It just takes a little bit of pre-planning, right? That's it, a little bit of pre-planning.
A little pre-planning, but I've had the same recipe for my overnight oats for like 4 years. It's like I got my dark 100% chocolate and my little peanut butter blobs, and everything is like, it takes about 5 minutes. But it does take but you know what? It's easier to pre-plan for a good diet than it is to pre-plan packing your bags to go to the hospital.
For sure. And the bills are a lot more expensive from the hospital. Although with food prices now, it's probably a draw. So.
It'll never be a draw. But people have to plan to be healthy, because I see too many people who are blindsided in the hospital, don't expect to be there for whatever. And I think, things like intestinal blockages, where all of a sudden you're fine. People are saying, well, this has never happened to me before. But for as much as we can do to prevent any kind of illnesses or conditions, I think we should do that, and we should take a little bit more time, because we're going to lose the time on the back end, and that's not a good thing. And that's hard for people. We all want instant gratification, every one of us, and we're not thinking about the future, and we want that glass of wine when we want to smoke the cigarette. Not me, but I think if people walked into the hospital and saw what was going on, then it makes you think twice. I know it makes me think twice about myself and being fit and eating well.
I agree. There's a saying, it's pay it now or pay it later,
That's
right? That's
exactly it, yeah.
How it works with everything, unfortunately.
And in terms of going back to like temptations and stuff, we did talk a lot about how to eat. And by the way, beans, I've mentioned beans before. Beans are a great way to add fiber to your diet. They're just super healthy, and they have protein in them. And I love telling people to eat more beans. You get used to it. But we really want to avoid the processed foods. And there have been so many studies out on inflammation and eating more processed foods. So we want to avoid anything that's highly processed, which I listened to a podcast, and the person said, if it came out of a factory and you can't replicate it exactly, it's processed, it's highly processed. So I think that's a good way to look at it. We want to avoid sodium because that wreaks havoc with our bodies. Refined carbs, white bread, white rice, white pasta. Although there are ways of even preparing those that make them healthier. Just really quickly, it's called resistant starch. Pasta, potatoes, rice. You cook them, you cool them down, and then you reheat them. And the carbohydrate molecules recombine to form resistant starch. So instead of being absorbed quickly, they go down to your large intestine and are fermented by the good bacteria. So if you're going to eat rice, white rice, or white potatoes, or white pasta, cook them and then cool them down and then reheat them. You won't lose a lot of the texture. You won't lose any texture at all, but it's definitely better for you. So if you insist on your pasta every Friday night or whatever, there's a better way to eat it that'll be healthier.
See, that's interesting, because in college, I went to college in Fordham in the Bronx. We lived in like the Little Italy area, and the food was amazing.
Arthur Avenue?
It was awesome. We lived on Hughes Avenue, and so right next to Arthur Avenue, and the eating was just unbelievable. But what we would do is, we had a little apartment. I had a couple of roommates, and we'd cook like a ton of food one night, and then we'd have like, a pound and a half of pasta sitting with garlic and oil or whatever, sitting in the fridge, and we wouldn't reheat in the microwave. We would fry it in like a cast iron pan. And fried pasta is so good. Mm-hmm. And you just throw it right in the olive oil that's in, you just fry it up for a minute or two, get the little brown bits on there, and it's like amazing. But then the ultimate fried pasta was thrice fried pasta. That's if you fried a whole bunch of pasta up and you had too much leftover fried pasta. So you'd put it back in the fridge, and then you'd fry it again the next day. And that was like the limits. No one's ever done 4 times fried pasta. I don't think it's been done or survived. But, thrice fried pasta was pretty crazy. And we didn't know it, but I guess we were building up that resistant starch.
And you're cooking with olive oil, which is high on omega-3 fatty acids, which is anti-inflammatory. So you were ahead of your time.
Exactly.
Very good. And I do love fried pasta. I've done that before. So in general, the refined carbs, find the whole wheat bread, find the whole grain pasta. There are a lot of pastas. You can't tell this to somebody who's Italian, but there are a lot of pastas made out of lentils or palm hearts. I've seen those.
Chickpea pasta. Seen that one?
Yeah, chickpea. I've eaten the chickpea pasta. I do like that. But I use when I do have pasta, which is not often, I use my method of the cooling and heating up method, because I like. Also, if you're going to eat pasta, it's healthier if you cook it more al dente, so your body doesn't absorb it as quickly. You want to stay away from saturated fats. That's fat that is solid at room temperature. So your butter, your cheeses, olive oil and avocado oil are the least inflammatory oils that I like to recommend. And you can really cook just about anything with those 2 oils. People say you can't get it to high temperatures. Avocado oil, you could really cook at a pretty high temperature with avocado. So those are great. Trans fats, which fortunately we don't have much in our food system anymore, but that's highly inflammatory. Fatty or processed meats, I think we all know that those are really not great, and then they are inflammatory. And sugary beverages, and a lot of sugar in your diet is very inflammatory. And I talk a lot about sugar to people because I work with a lot of people with diabetes. So whether you have diabetes or not, it's still not good for your system. And the number one source of sugar in our diets is actually sugary drinks. So Start right there. See what you're drinking. People come into my hospital, and the nurses and the staff, and we're all carrying our Dunkin' Donuts and our Starbucks that have 60, 70, 80 grams of sugar in each cup, and it just wrecks our bodies. So start by going more towards coffee, tea, water. Water's our gold standard. Seltzer, flavored seltzer with a little squirt of lime in it. There are a lot of great seltzers on the market now that don't have added sugar, that just have a little tiny bit of fruit juice. And hydration is super important for your body anyway, and that also keeps down inflammation. So really see all these foods that you're eating that are working their way into your diet. And over COVID, we were eating a ton of comfort food, and usually that's food that's salty, fatty, sweet, and it was not working in our favor. And we've seen people get more depressed and anxious, and they've gotten heavier. And I think processed foods that we reached for so automatically is a big reason for it.
I would agree with that 100%. So I think in terms of like the big picture here is, diseases that are caused by inflammation are very common. They're associated with the Western diet, or the SAD diet, the standard American diet. And if you want to avoid developing a condition within reason, you can't avoid everything with diet. There's genetic components. There's the unknown of diseases are caused by all kinds of things that we don't fully understand. There's bad luck out there probably somewhere. But if you take all those things, and you can't change the factors. Those are called non-modifiable risk factors. So age, gender, family history, all that stuff. You can't change that. But the things you can change, diet, lifestyle. I think if you want to avoid developing some of these conditions of inflammation, like diverticulitis, then the way to do it really is to eat a very high fiber Mediterranean style diet. Stay away from the processed foods.
And I also want to include the Mediterranean diet isn't just a diet, it is a lifestyle. So if you look at a diagram of the Mediterranean diet triangle at the bottom, you will see it tells you to eat with family, with friends, be social. And that's a big part of it. And the exercise also is a huge part of it. And it was hard to tease out. When you have people eating really, really well, you also have to look for, in any research study, the confounding factors. And a lot of people who do eat well, they are also exercising, and vice versa. So it's like, is it because of this or because of that? But we know that if you put the two together, it's a big part of it. So it's definitely not just the food. It's a lifestyle. It's being social. It's reducing your stress. It's exercising. Exercising is huge. But what you're putting in your body, it should be obvious that what you're putting in your body can either do damage or can do good.
Right. So, my answer when people ask me these, like, because everyone wants a granular answer of like, do this, do that, do this, do that. And my answer is just yes. And they're like, what do you mean? Because, should I eat fiber? Yes. Should I eat more fiber? Yes. Should I drink alcohol? No. But should I exercise? Yes. It's like, do all those things. Why do you have to pick and choose one or the other? You do a little bit of all those things, and there's that synergy that builds up between them all. And which one helped you the most? Like, who cares? They're all helping you. Just do them. Yeah, you don't have to do it.
Every little bit helps. Each little step helps. It's going to make a big difference in your life. And do what's comfortable and do what works for you. Everybody's different. You're not going to do something if you're miserable, but find the things that work for you. Find the workout that works for you, that makes you happy. Find the foods, the fruits, the vegetables that you really like. Nobody's going to tell you specifically what you like. You figure it out yourself, and then just stick with it.
Sometimes my body tells me to eat McDonald's. That's the problem. But I don't listen to it. I haven't had that in a long time. These patients who come in with recurrent diverticulitis, like our patient here, I feel like the diet for prevention is what we talked about a lot. But once you develop the condition, now there's a disease. So now you have alterations in the wall of the bowel. There's inflammation. Some of that inflammation is short-term. Some of it's maybe more chronic. I think you can see, if you took a biopsy of someone's colon weeks to even months after an episode of really bad diverticulitis, you could still see cellular changes there. There's probably stuff going on a micro level that you can't even detect. So I think, and the more repeated episodes you have, there's some chronic long-term changes that happen in the colon. And I think now it's a whole different thing. So like going from nothing to having, walking around having mild diverticulosis, like lots of people have, to your first episode of diverticulitis, that's like stage 1 of what we're talking about, and that you prevent that with all these diet and lifestyle changes. But now once you've developed diverticulitis, 10% of people, or maybe a little more, will go on to have another episode of diverticulitis within that first year. And once that cycle of inflammation gets started, does anyone know, I don't know if there's an answer to this question besides what we just talked about, but does anyone really know the best diet changes to make in that like first year period after you have diverticulitis? Is there something you should be doing more of, less of? Should you really be pushing the fiber up at that point? A lot of people complain that they eat, we tell them to eat lots of fiber after the first couple of weeks when they really like resolve from the acute inflammation. Oftentimes my advice is to, start gradually going up in the fiber, stay away from alcohol, don't smoke, watch the weight, do some exercise, all the stuff that we talked about. But is there anything more? Like, I don't know the answer. I don't think anyone knows the answer there. Like, is there anything you should do in that first year more aggressively, less aggressively? Should you be more worried about the fiber in the first year? Should you really push it hard in the first year so they don't get a recurrence? And then once they've had a few recurrences, like now you're dealing with like almost like a semi-chronic, subacute to chronic inflammatory condition. And that's like more, in my mind, I have to approach that on a case-by-case basis, because some people are ready to go back to normal diet. They feel great. And some people really, like, every time they introduce another gram of fiber, they're in here with, abdominal pain. And it's very tricky to navigate. I don't know if we know anything about that, like in terms of what to do.
Not that I've personally seen. In terms of like supplements, omega-3, fish oil pills or krill pills seem to have some benefit. When you're talking about a person they're doing everything they can and it comes back anyway, sometimes I don't even know if there's medication for that. I mean, I've heard that butyrates help. Butyrates are produced with the fermentation with the bacteria and the fiber. So they're naturally produced, but that's a supplement. I don't really speak to supplements that much, except for the fish oil, which I'm fine with recommending. But there are always going to be some people who don't respond. No, they're not going to respond, and some people respond right away and increase the fiber and be fine and never have a flare up. And then it's like with any other condition, no matter what you do, because we know that the diverticulosis is genetically based. So sometimes you do all that you can and you still have issues.
Right, and that's what we see. And, in terms of supplements, everyone asks for supplements and medications, and a lot of things have been looked at in small studies, and there's really no convincing evidence that most of this stuff works. People have tried what we give for like ulcerative colitis. They've tried mesalamine. People have looked at probiotic supplementation, and I don't think there's ever really been convincing evidence that they help. And, you can try these things in an individual person and see what happens. They're pretty low risk interventions, but there's no great reason to think that it's going to help more than just placebo or nothing.
Yeah, I've seen a couple of studies about probiotics, and I'm very pro probiotics, but that's just in general for keeping your gut microbiome nice and balanced. But I haven't seen any studies where there was a big difference in terms of never getting a flare-up or recovering from a flare-up. There just seems to really be nothing there that pushes the probiotics, unfortunately.
Yeah, it's unfortunate. And then the one thing I tell people to avoid are the NSAIDs, like which sounds silly because they're anti-inflammatory, but in the gut they're not necessarily anti-inflammatory. So that's been correlated with increased flares, like NSAID medicines like Motrin, Advil, ibuprofen, aspirin. Yeah. So that's kind of all I got.
I would add, if you're starting to add fruits and vegetables into your diet, which a lot of people will. I always get asked, well, which ones are the best? The best ones are actually the ones that you're going to eat, because if you hate vegetables, which I have more adults that come to see me that hate vegetables than kids do. Once they get to a certain age, they're like, I'm not eating broccoli, and they say it in a very young voice. But eat the vegetables that you really like. Write them down on a piece of paper. I like broccoli. Oh, I forgot, I like spinach. But try to eat a diverse group or vegetables, any kind of food that you eat. There should be diversity in your diet so you can get a full complement of antioxidants and vitamins and minerals, and especially in the fruits and vegetables, when we talk about the phytochemicals, the antioxidants. Every fruit or vegetable has a different antioxidant based on the color that it is, and all of those are just so beneficial. So we like to say eat a rainbow, and I hate that phrase, but it's accurate. So when you are going into the supermarket, like after you hear this hopefully, and you start buying your fruits and vegetables, try any of them. Whatever ones you like and that you'll eat is great. Our cruciferous vegetables are probably one of the best kind of vegetables to eat, and they also help prevent cancer, and that would be broccoli and cabbage and cauliflower. Dark leafy greens are super healthy. So there are some that have a little bit more of a punch nutritionally, but try everything. We have a wealth of vegetables and fruits out there, and just try whatever. Find the things that you like and just keep on eating them. But don't concentrate on any one type of fruit or vegetable or meat or anything. It doesn't do as much good, but just when you eat, vary your diet.
Yeah, I think that there's been, again, I'm not the expert in the microbiome by any means, but I think there's been some evidence that eating a wide variety of different fruits and veggies really like increases your microbial diversity as well, which is one of those things that they find in people who have inflammatory diseases, whether it's the cause or the effect, is like a loss of diversity of the microbiome. So like you don't have that whole ecosystem in there, which kind of gets into its own homeostasis. And when you have less diversity in your microbiome, you're kind of a setup for certain diseases. Now, cause and effect, I don't know if we know that yet, but it sounds like, eating a diverse group of different foods and staying away from the junk really does improve your microbiome on a microscopic level, I should say.
Definitely agree with that. And also, I remember reading some studies that for diverticulitis, to prevent the flare-ups, fruits tend to be a little bit better than the vegetables. Now, I hesitate encouraging people to eat too much fruit, because if your blood sugars are fine, you don't have prediabetes or diabetes, go right ahead. But if you do, you definitely have to watch your blood sugars. But for some reason, fruits tend to work better for that condition than vegetables do. Fruits and grains.
Interesting, right? And in terms of the diabetes thing with fruit, it's always a sticking point for me because I'm not necessarily qualified to give dietary advice for diabetics at all. But I always think it's a little funny that people come in and they say, like, I shouldn't eat too much fruit because of my diabetes. But you rarely see someone come in who eats mainly fruit, who became overweight and diabetic from their fruit consumption. It's often the processed stuff. The fruit on top of that is just adding now sugar, but that's a different like milieu than someone who is insulin resistant, overweight, or obese, has fatty liver, has diabetes. You add some sugar to that person and it just causes havoc. But and if that comes in the form of fruit, it's probably less offensive than if it comes in the form of like processed table sugar or something like that. But if you have a person who's otherwise generally healthy, is it common that people come in with frank diabetes from eating too many oranges? Like, I don't think.
No, I'm glad you brought that up because that is a thing. I work in a hospital and I see, I have people all the time tell me, I'm not ordering the fruit because it's got too much sugar. And I say, what's that? And they're like Lorna Doones on their tray. So that's okay, but not. No, I think in this case, what I'm saying is that to avoid getting a flare-up of diverticulitis, if I'm going to tell people fruit really helps, I don't want them to eat 20 pounds of grapes. Yeah. I don't want them to go overboard. I am pro-fruit completely because you have fiber in the fruit, you have antioxidants and vitamins and minerals, and I absolutely am pushing the fruit. I mean, it's on the Mediterranean diet. I don't want somebody to think, I'll get well if only I eat all this. And once they eat, like, I just keep thinking of the grapes, like, 5 pounds of grapes all at once. And if they do have diabetes, it's going to shoot up. But no, in general, I wish some of my patients were eating the fruit instead of like, it's amazing how the fruit has sugar. Oh my gosh, it's bad. But I'll have the chocolate shake and I'll have the Lorna Doones because I don't know why, but they don't have an answer for that one.
The red velvet cupcake, I see that floating around the hospital. Looks delicious.
I haven't had it.
Probably not good for you.
I'll have to try it. I sample all the food.
All right. Well, we covered a lot. We covered diverticulitis, diverticulosis. We covered inflammation. We covered a little bit of the microbiome and maybe a little bit of leaky gut and what you should eat, what you shouldn't eat. We talked about alcohol. I think it was a pretty informative discussion. Tell me a little more about where people can find you, Stephanie. I'm
dabbling in social media. You can find me at FoodBodyOver50 on Instagram, FoodBodyOver50 on Facebook, FoodBodyOver50 on TikTok. You can see me or reach me on X, formerly known as Twitter, at Nutrischiff, NutriSchiff. And I seem to be popping up all over the place lately, and hopefully I'll be back on the radio soon too. Very good. Well, it's a pleasure to have you. And I think this is a very informative talk. Hopefully it will help a lot of patients who have diverticulitis, and hopefully it'll help a lot of people who don't want to get diverticulitis in the first place, right? Yes. Well, that's it until the next episode of the Real GI Doc Show. If you wanted to find me, you'll find me on social media as well. It's Real GI Doc. I love questions. You can send me audio questions through the link at the show notes in the bottom of the page. And if you want to go on social media and leave me a loving comment or a hateful comment, I would love any comment. So find me on social media, Real GI Doc. And I'll see you next week with another exciting episode of the show.
That's it for this episode of The Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.